medications which, as Dr. Pomeroy already demonstrated, can slow down the progression by interfering with the immune processes. But they work only in the early stage of MS, and it's more where you have this transitioning. So it's like early stage, as it's going, the relapse is becoming less frequent and less obvious, and then that gradual progression kicking in. And that is the stage where the treatment seemed to be the most effective, because during that stage, again, as Dr. Pomeroy demonstrated, and I think Hannah touched as well in some of her slides, that where the inflammatory activity is the most dominant, that's where the treatment seemed to work. Unfortunately, for more advanced progressive MS, we don't expect current immunomodulatory drugs to have much effects, and that's why those are not even offered for the patients and not haven't been approved either. So out of those two drugs, medications which are available for progressive MS, one is ocrelizumab. The ocrelizumab is the medication for primary progressive MS. And it targets the type of the immune cells, which are called B cells. So there are two main types, the T cells and the B cells, and this drug affects the B cells. Possibly many of you have heard a lot actually about the B cells over the last couple of years, more than in the previous 10 years, because everyone is talking about B cells in terms of immunity. It's about the vaccine efficacy. The B cells are the ones which are producing the antibodies, and this particular drug affects these B cells, and the number of them which are circulating, and then in that order causing less inflammation and less damage to the myelin. So then the slide already demonstrated the scale of efficacy of the drug, and yes, it's still early to know how it will change as we go ahead, because the drug hasn't been used for long enough to see how it will change 10 or more years from where we are. But according to the results, the patients who have early active primary progressive MS and the ones taking the drug show 24% less likely to have increase in their disability in comparison to those on placebo. The next medication that we have available for progressive MS, it's called siponimod. It's much newer. It's become only recently available, and that is the medication for secondary progressive early MS. If you remember the slide that Dr. Pomeroy was sharing, the top one was the graph of the remitting MS and secondary progressive, and the bottom was more the little bit separated, more like a primary progressive. But again, in the early primary progressive disease, you can have more active inflammation leading to more rapid development of the symptoms, and that's where the drug has showed the best efficacy. But again, the duration of the trial has been relatively short. So in comparison to the duration of progression in the patients with MS. So whilst there is a reduction of disability, and we hope that the patients who are eligible will benefit, but at the same time, it's too early for us to know where it will be, where we'll see the outcomes 5 or 10 years after. Okay, so then